Next up, we have Bhuvana Krishnamoorthy, who's very kindly joined us and will be talking to us about all the great work she's doing on behalf of the Nursing and Allied Health Professionals Subcommittee. Bhuvana.
Thank you so much. Thank you so much. Good evening, everyone. I know this is a last talk. I'm tired as well, like all of you. So I will try to finish as soon as possible. And good evening, everyone who are already on the online as well. What I'm going to talk about for next 20 minutes is about the achievements of my 12 leads who are already there as NAHP leads, and including myself. And in addition to that, all of you who are already as a member. So the highlights of the last year, what we did is about the SCTS annual meeting, new additions, usually what all the things what we do, and plus, and also new technology in NAHP teaching, and mindfulness and well-being sessions for our members, and also new PA lead recruitment, because that is a one area we were not being strong. So we just started recruiting a PA lead, and speak up NAHP members. These are the topics I'm going to cover. So SCTS annual meeting, if you look at it, new sessions, usually historically, the wet labs is absolutely fantastic. We always have sometimes 150 or 250 people attending the sessions. But always the AHPs raised a concern. It's always mostly nursing focus. So what we did was, with the help of our physiotherapy lead and perfusion lead, we added more sessions for Sunday University Day, in addition to the normal NAHP wet lab sessions. The physiotherapy sessions were attended 70 delegates, and also the perfusion session attended 80 delegates. The learning points, what we learned, it's absolutely amazing to see 70 and 80 perfusionists and physiotherapists coming. But the problem is we didn't have enough room. And we've been allocated only one room. In that room itself, we have to do 2 2-hour sessions, which is really very less time for them to have a hands-on sessions. So what we thought that it will be really good for us to do a full day session. However, for us to justify to get another room for the money to the president or to the SCTS annual meeting chair, we need to know the exact number of within that physiotherapy session or perfusion, how many were the real physiotherapist or perfusionist trainees and also qualified, so which we forgot to capture. I'm sorry for that. So some of the topics we did, it was perfusion topics about, it's all about the median score, which were out of 5. So post-cardiac VA ECMO was 5 out of 5. ECMO cannulation air handling simulation, they all used their full simulation. It was 4.5 out of 5, and oxygenator failure, tips, tricks, and traps. What happens? What do you need to do in that situation? How to be panic? It was really very interesting sessions, and it was 4.5 out of 5. Physiotherapy session was divided into 2 parts. One is ERAS. ERAS is what is ERAS? It was 4.25, and then occupational therapy involvement in ERAS itself, how it's important. It was scored 4.83 out of 5 median. And the physiotherapy involvement, ERAS 4.48, and dietitian involvement 4.17. And the second session was really about how the physiotherapy, if you look at it 20 years ago and now, how they have evolved, is about introduction to evolving the roles. It was 4.55 out of 5. Collaborating working, it was really good with the multidisciplinary team, 4.19, and AHP non-medical prescribing, 4.44. Followed by assistant practitioner role. That's what they are bringing in, same like a nurse associates. And we used to have as a nursing. So now they're bringing up practitioner assistant roles as well. Then we thought, why can't we add a VR technology? Because that is the future now. Then we have to think about the AI and GPT and everything. We introduced a VR technology for calls and simulation sessions. Some of them, I'm not going through all of these things. So in March 2023, SCTS University, we had a virtual calls study day, and it was supported by the Erasmus University team and our SCTS. And the QR codes were introduced to all the people who are coming in and coming out. So to scan after finishing the session, there are more than 250 came inside the room, and they went and they've been participating. All the attendees were voluntary to fill the QR code form, and was 191 forms were completed as evaluation. So profession highest attended was a nurse, followed by medical students, and then we had co-trainees, and then 2 operating practitioners. And the gender was predominantly female. And then sessions where we did cardiac sessions, 191 in the morning. That is a session we always have quietly, heavily come. And then followed by thoracic sessions, always is dies down in the afternoon as well, 80. And then via calls were 191. The enough time given, this is a very difficult because the university day is being given one day from morning 10 o'clock to 5 o'clock. Then afterwards, everybody needs to go for the pub quiz and everything. I can't be given permission to increase because Cha always tells me off, no, you can't have it. And that makes a difference for us. And most of them, if you look at it, everyone said it's not enough time. And we had a meeting 2 days before, and even the Farah Bhatti, consultant surgeon, she said herself, the medical students have not been given enough time in the morning. So maybe we need to have, a re-strategy of how can we maximize the time for learning. And via calls, 148 said absolutely fantastic, they enjoyed it. And 139 said it's absolutely relevant to them. And also, it's really about strongly agree. We are joys to the session. Yes, of course, it's cool to have glasses around and just to play with them when you are, rather than just messing around with the iota, or sometimes the people, they don't like the smell, but the VR was really, really interesting for them. And also how easy was the calls VR sessions, very easy, 126, and some of them said, oh, it's 18 difficult, I don't like. The most of the people who said they don't like wearing glasses, they find it a little bit difficult, which was not really adaptable for them. And I did feedback to the Erasmus University about that. So simulation-based hands-on, it was very good, 179, and hands-on wet lab, 152 said absolutely fantastic. Most of the voluntary who we always get it, all the surgeons, trainees, and nurses, allied health professionals, they were absolutely in teaching. And company trainers, one of the main thing what we have changed is, rather than bringing a clinician from everything, then we have to pay for them everything, bringing the surgical trainers or company trainers really is very cost effective for us. We have saved quite a lot of money on these courses, educational courses for NAHPs. Training simulation models, it was 147 said excellent. And one person, I don't know who is that, couple of them always said poor, they didn't like it. So ECMO simulation, then we had extra full body ECMO simulations, which was arranged by the Medtronic, and the 190 people said absolutely fantastic. They were asking whether can we able to run these courses more and more. Atrial ablation sessions, again, 93, and laparoscopic skill session, everybody loves it because you have lots of prizes there and also competitions. Who comes at the end, they get lots of awards. And Ethicon as well, they have brought a new Simundo, which is really good for you to do the laparoscopic skills. These are some of the things. I'm not going to go through everything. So then finally, we did via mindfulness and well-being sessions, which is one of the important things. As you all know that, according to NHS Digital January 2020 report, more than 400,000 people are absence of sick due to anxiety, stress, and depression. Rescape via Dr. Technology Frontline have developed a beautiful via mindfulness and well-being session. So they gave us quite a lot of set, and they came on 3 days. There were 3 available timings. One is 3-minute session, 7.5-minute session, 15-minute session, and 95% took 7.5 minutes, and 5% took 3-minute session. And the date attended, we had 3 dates. If you are attended, you may have seen there was some gentleman who was sitting in front and he was doing registration task, 19th, 20th, and 21st. The majority were attended on 21st of March. And then gender, it was 66 female, quite a lot attended, then followed by male. And the professions quite a lot attended were nurse, followed by consultants. So I was really amazed to see lots of consultants had time to go and relax with VR. And then we asked some of the questions. It was iPad, then they just voluntarily filled it. And please tell us, how do you felt today before starting the VR mindfulness and well-being session? 36 said anxious, There were some of them were annoyed, and also 20 were neutral. How stressed are you before starting the VR mindfulness session? 42 said somewhat stressed. And before using the VR mindfulness, how much time do you allocate to prioritize self-care, looking after yourself? 24 said once a week. And 13 said they never have time to sit down to do anything for themselves. Because of mainly as a female, including myself as well, we never have time running around here and there with the kids and everyone. I'm just joking. After using the VR mindfulness and well-being session, I felt relaxed. Majority agreed. And after using the VR mindfulness and well-being session, I felt calmer. 66 said agree. And after using the VR mindfulness and well-being session, I felt less stress compared to before attending session. 66 agreed again. And using the VR mindfulness and well-being session made me to think about doing self-prioritizing my self-care and myself. 66 agreed. Some people say I disagreed. So general comments, and these were just teamed up together. And 30 people said enjoyed a lot. One person said they liked it, but they didn't really like it because of claustrophobic effect. And some of them said, felt uneasy. And some people said people are crazy in this and just wanted to relax. And some people after the presenters, I think they came and said, thank God you had this, because I had a very tough time presenting in front of lots of consultants. And also 20 said it was fun, really. And they said it's a great progression. 10 of them said great progression to the SCTS to new technology. And really we want to be, I prefer to have VR every day in the morning at work. And also health and well-being should be prioritized by the SCTS. So to move on, this is our new physician associate NAHP lead. Her name is Ramjit Kaur. She is a PA in John Radcliffe. And also her important role is to raise the PAs, because if you look at it, there are lots of surgical care practitioners, nurses, allied health professionals we have, but we have very, very small community of PAs. And that's one of the role is to promote and develop the role. So one of the main campaign with the, all of the executive team have started is especially for the nursing and allied health professionals about experiencing bullying and harassment at work. And some of this, we will not even speak up, and sexual discrimination and assault. I'm not going to go in detail. You all heard about it. And also undermining, whether can they able to do it or not able to do it. How can we support them? Racism, that is still quite a lot there, but far better than 20 years what I have seen and now. And some of them, they do not have any career progression, moving from band 5 to band 7 or band 8. And some of the specialties, like if you look at data professionals, operating department practitioners, they're always on band 5, band 6, unless until they go on the management route, then they can get band 7. Otherwise they are. If you want any confidential advice, anyone has NAHPs, also all your colleagues, please tell us. That's what we are here for. So in conclusion, please join us. If you look at it every time I look at the number, it's absolutely fantastic, because when I took this job 3 years ago, Naren and Mr. Simon Kendall always told me, can you call me Simon? I said, no, Mr. Kendall. If I get 1,000 and more, then I will try to call his first name, but still I don't think so. But it's increasing. Every year it's coming up, and we are trying hard. Please tell all the consultants, please ask the NAHPs to be part of the team. If they are not part of the team, we cannot do anything. Email us, and also please encourage your NAHPs to be part of the educational faculty. We have every month, we have one course we run, and it's all free. They will get an enjoyable time with us as well. And it's all informal, hands-on teaching. And we will coach them to be an educational lead too. Get involved also in the nursing and AHP's national and local research and audit project, and also QI, and we will bring money for them as well. And there are lots of traveling fellowship, educational fellowship. I'm still, asking our team to get more and more. Let us know If there is any mentor needed or anything else, chair sessions, we are happy to see new faces because new faces bring new ideas, and that's what we are looking for. Finally, speak up and we will stop everything together in bullying, harassment, and undermining. We are here for you. Any questions for me, please? Thank you so much for listening.
Thank you, Bhuvana. That was just a mere tip of the iceberg of all the work you've been doing, and just congratulations again on how you've driven things forward for the past 3 years. Any questions from the audience about SCTS's NAHP activities, or any questions for Bhuvana?
Bhuvana, I've been lucky enough, like lots of other people have, to come to some of your courses and be faculty, and they're amazing, great energy, and it's really great you're bringing this people into our society and educating. I've got a question for you, and I don't think we're going to come to the conclusion of that right now. And I'm somebody who really values the wider skill set, the different roles. At the moment, there is a discussion going on, and people have got different views. BMA's got a view, Royal College of Surgeons have got a view, America's got one view, we've got one view about the role and also the name of the physician associate, physician assistant, depending on what they are. What do you think? And if you don't want to say now, because I realize it's controversial, where do you think we should be going in this journey?
Ask me honestly, is they made a mistake. So if you look at 25 years ago, someone from the NHS England with lots of knowledge, but they didn't have the knowledge what is happening already on the floor. They went and they saw the physician assistant, what they are doing, amazing. They came back, they started surgical assistant, surgical care practitioner, physician associates, then ACPs, advanced nurse practitioners, advanced nurse. So that's what the problem happened, because they diluted and separated this, even though everybody does the same job. They have given different titles. So if you look at it 22 years ago, we had the same problem as the surgical care practitioners. We used to call surgical assistant. Then we said no surgical practitioners. We never had any curriculums, everything. So that's the same thing going on with the physician associate. People are not understanding. So what we came up with from the Association of Cardiothoracic Surgical Care Practitioner, we came up with the patient information leaflet. We put it who we are. We are not doctors. We are not medically trained to support. And that gave lots and lots of insight to the patients. When they come, they know who we are. We are not doctors. We are treating. And that is widely accepted. We did present that, me and Mr. Norman Briffa, here in the meeting long time ago, 10 years before. And that's what we need to do. We need to do a survey. I know that I do not add anything about what is quite a lot of uncertainty going on everywhere about the physician associates, but hopefully that will settle down. Royal colleges are looking into it.
Yeah, because we really want this group of people to be valued, well recognized, trained, comfortable in their jobs. And we want the public to be reassured about not only who they are, but what they can do. And I realize that, it may have been, it's always a few cases that give something a bad name. There's also, parts of the BMA are resisting. So I'm just, I'm really saying, how do we navigate this pathway?
I think we have to work together with the NHS England, BMA, Royal College Surgeons, and also SCTS. Maybe better to put a leaflet about all the different non-medical professional, what they are, how they need to be treated, and then put it on a website and send it to all the centers, cardiothoracic centers, and that may be a little bit helpful to them as well. Naren, anything to add?
I know this because we're having ongoing discussions with the colleges about this. There's a huge Twitter debate going on because of concerns, especially from the BMA. Our response, and this is something Bhuvana and I have already put out to certain parts of the membership, is the society is here about improving patient outcomes, and the understanding that we do this with an extended surgical team is paramount to how we deliver cardiothoracic care at the moment. There is, of course, importance about how we communicate that to patients and everyone understanding their roles. But I think it's paramount that we all appreciate the hard work that all allied nurses and allied health professionals do and contribute to the care that we deliver. It isn't just one person that makes the decision about how a patient outcome is. And I think it's incumbent on all of us about communication. We're currently having a lot of debate in the college about how this is put out there, but I think it's incumbent on everyone, if you watch what's going on the Twitter debate, that we support all our nurses and allied health professionals, because they deliver a phenomenal service for our patients.